health care reform for this country. So what do they need? A handful of Democratic lawmakers who are still undecided on how they will vote. Joining us now is one of them, Congressman Boccieri of Ohio. He is one of those Democratic House members who says he is currently undecided. He voted against the House health care bill the first time around. So as it comes back around this time, what are you thinking, Congressman?
Well, thanks, John. First of all, our nation needs to have this debate. We need to reform the system and do it in a way that doesn't explode the deficits, contains costs, and make sure we go after waste, fraud, and abuse in the system. Those are my top lines in making sure when we discuss this bill.
Well, you voted no the first time. What's different this time around that has you undecided?
Well, first of all, we don't have a copy of the bill. We haven't had the opportunity to read it, and myself and my staff will go through that with great detail to make sure that we do that when we reform this system. Making sure we end the abusive practices of the insurance industry where they drop patients because they get sick or because they had a pre-existing condition, and where we see the inflationary costs of health care that are rising faster than wages and faster than inflation.
A lot of House members have said they don't like this process. It's going to call for the House to essentially swallow the Senate bill and then hope it gets fixed again through reconciliation. Here's what Senator Lamar Alexander, a Republican obviously, of Tennessee said. He says, quote, what the president's really asking House Democrats to do is hold hands, jump off a cliff, and hope Harry Reid catches them. Is that accurate? And if so, do you trust him to catch you?
Well, I appreciate the senator's remarks, but quite frankly, 20 of the last 22 reconciliation and the processes that we've used have been used by Republicans when they controlled Congress or by a Republican president in the White House. So this is not something that's unfamiliar to them. The process that we're going to use is a simple up or down vote. The American people deserve this, and we deserve this in Congress. We've been talking about it an awful long time.
As you well know, you're being targeted by Republicans who think they might be able to win back your seat next time around. There are robocalls going out to voters in your district urging them to get in contact with you and vote no on this bill. How much does that affect what you see as your vote here?
Well, John, I know I've answered some of those phone calls, and what I can tell you and what I tell them and my constituents in my district are that members of Congress should be less concerned about their own job security and about the job security of Americans and their health care security, because when you lose your job in Ohio, oftentimes you don't have health care insurance. Our nation needs to have this debate, and we need to come to some decision one way or another, an up or down vote, yes or no. And so I applaud the president for pushing us forward on that.
But it comes down to Nancy Pelosi pushing you on one side and a good percentage of your voters who elected you pushing you on the other side, right?
Well, I've stood up for my district. I voted against the first House version. I didn't think it went far enough. And I'm hopeful that as we move forward, that we reform the system. We've already voted for a number of measures that reform the system, like ending the antitrust immunity for the insurance industry and making sure that children in our country have access to health care, all children. So I'm not afraid to cast a tough vote, and I'm not afraid to stand up to leadership in doing so.
Congressman Boccieri of Ohio, thank you.
Thank you, John.
Well, take a look at these shapes. They look like kids' vitamins, don't they? They're actually the latest dangerous party